first actually heard of Leon before I actually knew him. And when you're working around the Capitol and you hear about mental health services being provided in the community, you oftentimes hear of what's going on in Bexar County. Because Bexar County has this great opportunity. A lot of times, I don't know what the luck is down there, but there's private programs that start down there. There's all these just really thoughtful programs that are really seeking to serve those with serious mental illness or substance abuse, the homeless population, whatever that might be, in any combination, that there's something special going on in San Antonio. I wanted to share that with my colleagues at my office. We went down and visited Haven for Hope. We met with Leon and some other folks that work with the center there. And we just had a great opportunity to learn about what they're doing in Bexar County to serve those with lived experience of mental illness. But then we were also talking about the opportunities of using peers in the correctional system. And they said, hey, you know what? We're working on a grant to do that, and we're about to send it off. And this was in April of just this year. And so it's been, they've just started implementing a program in July, I believe. And so they've got other things that they're working on that are going to be insightful for us. And I think there's a lot we can learn from what Leon and his colleagues are doing. And there's a great opportunity to see how we can take what y'all are doing and see where we can go from others and across the state. So I'll let them work that out and we can get started.
Go back. Okay, so Sheriff, I admire you greatly. I think probably the sheriff in Texas is probably the most powerful elected official in the community. We have a great sheriff, Sheriff Pomerleau, whose brother actually died of a severe mental illness. She's a retired 2-star general, and I hope you two partner up. I know she's going to go to D.C. and speak in D.C. So I just want to talk about the criminalization of the mentally ill. We are known. I spoke at Loyola Law School a couple of weeks ago. We've got a delegation from Kansas at our place today. There's somebody there all the time. And we're like next to last in per capita funding in Texas. So you saw where Texas is. Well, we're like Guam or Puerto Rico in funding our third world country. But because we keep a lot of data on costs and outcomes, and we involve the entire community, we get a lot of local dollars. So we get money from the city and the county and the hospital district because we can actually prove that we're having a huge economic impact on those systems. And so when people come and visit, they're always impressed with our services, but the thing they're really impressed with is how'd you get everybody to work together. So it's people like the sheriff who call the community together, and we're all underfunded, we're all overworked, so there's got to be some leadership that makes us do it, that makes us come together and work on these issues, or we're going to continue to be siloed and it's not going to work very well. So kind of the secret in our community is two things. It's a community collaboration and the use of peers. I learned from Janet a long time ago, nothing about us without us, and they're kind of our secret sauce. So, it's incredible. And when we first started hiring peers, we didn't do a very good job. We didn't have the Via Hope training. So we hired prosumers, we put them in our outpatient clinics. They weren't part of the clinical team. They felt isolated. It didn't work very well at all. So the way we're using peers now is they're part of that continuum, and we're having amazing success. I want to talk a little bit about the intercept model because we really concentrate on keeping people from going to jail in the first place. And I'm going to show you a roll call video.
We got it.
Okay, let's do the roll call video first if we can.
A little bit of an experiment. We're going to see if this will work.
I'm going to take off the blank screen mode.
That would help. Maybe, maybe not. We'll see if there's a...
So I think this first one may be roll call. If it is, we got law enforcement officers to do the video, and we take it to the substations, all the law enforcement facilities in San Antonio. We went from 1,100 people a month being brought to our restoration center who used to go to jail or emergency rooms or put back on the home on the streets who are homeless to 2,100 people a month. So that's 25,000 people a year who used to go to jail or emergency rooms. They're actually taken to treatment. Okay, so that's we were in the second round of the SAMHSA jail diversion grants, and there were 3 rounds. We're the only people, the only grantees that came together before we wrote the grant with a group, and we had consumers and families and lots of people, and we decided people shouldn't have to go to jail in the first place if they had a mental illness. So our jail diversion grant actually concentrated on diversion before you go to jail. All the rest of the grants, all 3 rounds, everybody that got the money put somebody in jail to recognize and identify people with mental illness, do discharge planning, so when they got out, hopefully they get into treatment, so they didn't decompensate, being that vicious revolving door. Still looking?
Sorry.
That's okay.
We have it here now. We can't get it to go up here.
Okay, so let me talk about the second intercept model. We're working with the Council of Governments right now, Dr. Fred Osher and Tony Fabello in our county. And so we actually, the county has contracted with us. We have staff and bookend. So there are lots of people that slip through our first diversion, okay? So if you haven't committed major crime, you can be taken to Restoration Center. So the second intercept model, before you go to jail, we actually have staff that are doing mental health screenings. They also have access to the care system, so if you've ever been treated in one of our state hospital or community mental health system, you're there. They're also doing dangerousness evaluation. So after they do that, if they identify somebody that has a severe mental illness who isn't a threat to themselves or the community, then they get back with the judge before they go to jail in magistration, and we do some kind of conditional release, a mental health bond, personal recognizance bond, or some kind of conditional release that gets them to treatment so they can go to jail in the first place. That's our second diversion point. Our third is there will be people who have severe mental illnesses or co-occurring disorders who commit crimes that the judge is not going to look like. You are going to go to jail. So we do have people in jail that are trying to, we're trying to endear ourselves to those folks, get them into treatment when they're discharged so they don't decompensate to the revolving door. Our fourth intervention point is the reentry programs in all what I call therapeutic justice or problem-solving courts. So we support the children's court. The children's court's about parents who have these disabilities, these illnesses. If you want your kid back, you need to get in treatment. So we support the children's court, the drug courts, the veterans court, and the mental health courts. The drug court actually has the first co-occurring court in the United States, so we provide mental health treatment to people with substance abuse. At the Restoration Center, I'm talking real fast because I don't have a lot of time. These presentations, I usually spend an hour and a half. So we have a sobering and detox unit and a mental health unit in the Restoration Center. So a lot of people that are brought into sobering and detox, once they get sobered up, we find their underlying emotional disturbance or mental illness. They've been self-medicating for years and non-diagnosed. When they come in the mental health unit, once we kind of get them stabilized, we find out they've been using alcohol and drugs. So really, it's very important. We were talking about dishes earlier, somebody, and even though it used to be the CADA and MHMR, they're still fairly siloed in dishes, and that's a shame because that doesn't work well for anybody.
I think we're ready to try it.
Okay.
If you want. Now's a good time? Okay. Is there a sound?
The following message is from the Center for Healthcare Services, proudly serving law enforcement and first responders in our community.
If you have an intoxicated person on your hands, bring them here.
You have an emergency detention? Bring them here.
If you have an injured prisoner and needs medical attention, bring them here.
Within the last few months, the Restoration Center has made tremendous efforts towards the speed and delivery of services for law enforcement officers in our community. Hello, I'm Brittany Berry, Clinic Administrator for the Mobile Crisis Outreach Team. We've made a number of improvements to assist law enforcement officers with prisoners and people in crisis on an ED needing medical attention. Over 1,400 people per month are diverted and connected to quality care in an effort to reduce arrests and emergency room visits. Welcome to the Restoration Center.
Our goal is to provide fast service delivery in order to take the individual AP, inebriate, or ED off your hands, or provide medical attention to your prisoner so you can get in and out and back into service quickly.
The Restoration Center cannot take violent individuals. They don't have seclusion or restraints.
The Restoration Center does not take juveniles.
If the person is seriously injured or suspected of an overdose, you should go to the nearest emergency room.
Honestly, if the person is that seriously injured, EMS needs to transport them to the ER.
Just remember, the rumor about calling ahead is not true. But if you do have questions, call this number.
If you're not familiar with the location, 601 North Rio is downtown, less than a mile from the MAG. The entrance is off Haven for Hope Way.
This is where you park.
Whether you have an injured prisoner, emergency detention, or an inebriate, they'll take them off your hands quickly and get you back on the streets as soon as possible.
EDs, 15 minutes or less.
Inebriates, no wait time. Just drop them off.
The place to sit down and write your report.
Injured prisoners are served immediately, not like long waiting times in emergency rooms.
24 hours a day.
7 days a week.
365 days a year.
At the Restoration Center, law enforcement is our primary customer.
The Restoration Center thanks you for your service.
That was easy.
Yeah, they have it all here. We were in and out. Wonder why more guys want to use this place.
No kidding. Maybe we could tell those guys at the Restoration Center to make a video so we can get the word out. And you know what? Me and you can even star in it.
No, man. I'm too shy and you're too ugly.
So the first time we did the video was 1,100. Within 3 weeks, we had to do it again. It was 1,400. So now it's 2,100. So we're just going to stop, redoing the video with the numbers. So that's 25,000. There are a couple things in there that says we don't take people who are dangerous. Well, almost everybody that is brought in there is many times brought in shackles and pretty disturbed. Our staff just uses de-escalation techniques along with the law enforcement officer. We talk them down, calm them down. We don't reject hardly anybody. So who would be considered violent, in most cases, we don't. And they find a place for treatment and caring. The thing about juveniles, one of our 1115 waivers is we have a children's crisis unit just like this. And several years ago, we developed the first curriculum in the state for school police. In fact, in the last session, the Texas legislature passed a law that requires all school police to go through that training. They exempted us as a kind of a way to honor us. So now we have a place where kids can be taken rather than taken to detention center or getting kicked out of school. They can be evaluated, treated, and got into a more appropriate setting for treatment. So I can kind of go on and on and on. Do we have time to show the last video?
Tell me what it's called. We had it, but it's not there.
It's called Brave New Films.
And it's also on YouTube.
Yeah. So one other thing real quick. We were talking about Tacoma, and Dr. Fabello, did that research, and the governor fired him over his report. And that's how the Texas Commission on Offenders with Medical Impairments.
Is this it?
I don't know.
Why are we using prisons to treat mental illness? No.
Maybe. Click on it, see what happens.
It's one of several police shootings involving people with mental illness.
18-year-old Keith Vidal struggled with schizophrenia. He wasn't violent. All they wanted was help getting him to treatment. Seconds later, the officer shot and killed him.
They murdered our son for no reason.
Another disturbing video that raises questions about the treatment of the mentally ill behind bars.
He would hear voices.
The extraction team restrained him. Minutes later, the 33-year-old was dead.
Jails are the #1 mental health facilities across the country. They house more mentally ill person versus any hospital, any psych facilities, anything. They're patients, not prisoners.
Mental illness is the only disease that when you're in a crisis, the cops are called. If you're having a heart attack, you don't call the police.
People with mental illness are being criminalized instead of being provided treatment.
These county jails and law enforcement, that's a public safety net. That's where you end up.
There has to be some sort of solution, some sort of help for people who are suffering from mental illness and become involved with the police.
Jeff was the youngest of our four. He was finally diagnosed a paranoid schizophrenic. When he was totally out of control and very frightening, I would have to call the police on him. They didn't know what to do.
I would get calls all the time when I was on patrol for a person who was in a mental health crisis. I had no clue how to handle it. And I would just keep getting the repeat calls every couple days or every week to the same house, the same person. And I just accepted it that, this person's just going to be a repeat caller.
We decided very early on that we needed to address folks that were nonviolent misdemeanor offenders that were truly being put in jail because of their illness. We knew that it was law enforcement that were first responders and that they would be the ones that would be in contact with individuals in crisis.
So we decided what we would do first is train law enforcement officers in 40-hour crisis intervention training. So they're trained to recognize mental illness. When they come up on somebody that's got kind of strange behavior, they're not using their command voice and their command presence like they're taught in the academy. They realize right away that this person has a problem. We brought together a bunch of law enforcement officers from the sheriff and the San Antonio Police Department, and every one of them didn't want to be there. I heard things like, I'm a cop, I'm not a social worker, I don't believe in these hug a thug programs, and this is a bunch of BS.
Before I went through the 40-hour CIT training myself, I didn't have the resources on how to handle mental illness. Well, now, it's way different. You know, I have confidence that when I go into someone's home, if they are experiencing some type of, mental health crisis, that I can get them to the right facility, and then I may never hear from them again.
I'm a mother, I'm a sister, I'm a friend, I'm a voter, I'm a volunteer, I'm all these people. I contribute to my community, and I have a mental illness. My diagnosis is major depression with psychotic features, dissociative identity disorder, and panic disorders. I've done the presentations to CIT training, and I tell them, I want to be treated the way you want your mother to be treated if she was ever diagnosed with a mental illness. I'm in a crisis, I'm having a crisis, and I don't understand what's going on around me. Get down! Get back! Get down! Don't do it!
In incidents with people who have mental health issues, it's unfortunate to see the ones that result in the use of deadly force, where an officer didn't have CIT training and possibly armed with that kind of information, that kind of training, outcomes may have been different.
I never knew each morning when I got up what I might find. He began to talk about a fire in the garage. So I thought, would he, without knowing what he's doing, start a fire? How much danger is he in, and how much danger am I in? So I called the police and I said, I'm terribly frightened. When they arrived, I introduced them to Jeff, and in this case, they came in plain clothing. They weren't in police uniforms. Now, they could have handcuffed him, I guess, and pulled him out, but they are taught how different that person is that they're dealing with. So they began to talk to Jeff. If they can get the person that's ill to, in their own mind, they're cooperating, is far less violent. It's better for the patient, and certainly it's better for our police.
When nonviolent people go to jail with mental illness, they say it's 3 or 4 times longer than a violent offender. But when they get released, if they're not hooked up into treatment, they're going to be right back in. There are so many people in their emergency rooms who shouldn't be there. The previous police chief here has actually kept data on how long his officers were spending in emergency rooms waiting for psych evals and medical clearance, 8 to 14 hours. He spent $600,000 a year in overtime. Now here at the Restoration Center, the law enforcement officers are in and out within 15 minutes.
What we have here at the Restoration Center is services patients who are in crisis, either walk in or brought in here by CIT. they recognize the patient's in crisis. They're not truly suicidal. They don't really want to hurt somebody. They just need help.
There are about 18,000 people a year who are brought mainly by law enforcement officers to this restoration center who used to go to jail, emergency rooms, or put back on the street. If you're a taxpayer and really don't know a lot about mental illness, the fact that the public's a lot safer when these people get treated, and the taxpayer saves a ton of money. Over the last 5 years, we've saved about $50 million in taxpayers' dollars.
We want everyone trained because of the potential daily that someone's going to come across someone who's in crisis. It's not a matter of if, it's a matter of how soon.
We've been coming up on 6 years of existence, and we don't have a use of force on our unit, which means we've never tased anybody, we've never shot anybody, we've never hit anybody with an asp. But patients, talking to them, we get the result we want in the end, and we don't have to force it on them.
You want CIT to respond because you're going to get the help that you need rather than being sent to jail.
The issues that police officers have with people who have mental illness is not unique to San Antonio. That's all over the country, all over the world. So any city that would decide to focus on this, put an emphasis on this, would certainly benefit from it.
I no longer thought, what if they have to shoot Jeff?
We save money, we improve public safety, and people can get functional again. I mean, why wouldn't you do this? It's really a no-brainer.
So I know my time's almost up, but I want to make 2 quick points. No-brainer is a Texas term, by the way. One is, when I make these talks, I always tell the audience I can prove treatment works through the Texas Department of Criminal Justice, Tacoma. So we get people with severe mental illness who used to be in the prison system, who don't make good prisoners. They have mental illnesses. And I'm sure that's true, Sheriff, in your jail. So it's hard to obey the rules. You know, they're listening to voices, they're not obeying the rules, they're in lockdown a lot of times. They never get any good time. They agitate the other prisoners, so they make it dangerous for everybody. So the episode cost is very expensive because they usually go to some kind of a lockdown or medical unit, and they never get any good time. So if you just look at that cost, and that's one reason that Texas developed the Tacoma. So if you're on probation here in Texas, the average person on parole in the United States, 3 to 5 years, the revocation rates are 40 to 60%. If you have mental illness, it's a little higher. After 5 years, it's up to 75%. And if you have mental illness, it's even higher. Well, here in Texas, when people are put on parole, the condition of their paroles, they got to see my psychiatrist, they got to take their medication, they got to do their alcohol and drug screening and so ordered, and generally stay in compliance with treatment. The revocation rate in Bexar County is 6.6%. So treatment works. It's just how do you get people engaged, you know, through motivational engagement and other things. So that's where peers can come in. We found by utilizing peers, the chance of us engaging people and actually getting them to treatment really increases without using the law enforcement process. So I could go on for a long time like everybody else here, so thank you.